your immediate family member had a colon cancer, either 10 years before or at the age of 40, whichever is nearer to you.
Okay.
So you should undergo colonoscopy. There's been some studies and research about dragon fruit having a natural laxative effect, that the patient would come to us and tell us that, if I'm eating and I feel that something's getting stuck in my chest, that could be a sign of cancer as well. So these are red flags.
Your father was an actor. He played the role of Yudhishthir. Hi, I'm Dr. Aditi and welcome to the latest episode of Talk Tonic podcast. Today I want max to max Indians watching this podcast because the most common household problem of gastric, that is stomach related issues, are going to be addressed, which is extremely common in India and people really don't know how to handle this. And for that we've got you, Mumbai's top gastroenterologist, Dr. Shamsher Singh Chauhan. Welcome sir, welcome to my podcast and thank you for coming.
Thank you, Aditi, for having me on the show.
So I recently read, sir, that around 22% of the Indian population, adults and kids included, suffer from constipation. Now, this is such a basic problem, and till now people find it difficult to find actually get a solution for this. So, can you throw some light on this?
Sure. So, constipation is a pretty close subject to my heart because many patients are unaware that they are facing the situation. उनको पता नहीं है कि they are actually having constipation. And when you compare the people from the West, when you compare people from India or the East part of the world, the constipation definition differs. So, in the West, if they go in once in 2-3 days for pooping, it's normal for them. But in India, if you go even 2-3 times in a day, you still will feel constipated. So it's not that our diet is similar to them. They have a less fiber in their diet. In the West, in India, we take a lot of fiber, but many a times patients do come to us that they're not having that complete sense of evacuation. They're
That
not
sense
having,
of satisfaction.
exactly. Ki, suppose you go in the morning, you have this urge and you're sitting in the washroom and you are not satisfied, and that's probably the reason you're going maybe 2-3 times a day. And then they feel that it goes on for probably years until they realize that there is a problem, and that is when they would come to a doctor to understand what is the issue.
Correct. So, like, what are the different causes or solutions for this kind of a problem?
So, constipation is, if we would, as doctors, as gastroenterologists, classify, we would broadly classify them into three. And we would say slow transit constipation, where your intestine is slow. Slow in the sense, the morning urge, the first thing that you get in the morning when you get up, in people who don't have constipation, they don't have that. So when they get up, they're doing their daily activities, but they're like, I'm not getting that urge to pass motion. I'm not getting that feel to pass motion.
Or some people get that urge only after having tea or coffee.
Exactly. So it's
they've trained their brain to
exactly.
be like that.
So this is kind of an adaptive mechanism by the body where they would use it to pass motions. This is kind of absent in patients who have slow transit. The other is normal time constipation, where they would have normal transit constipation where the intestine movement is slow, but because of certain diseases like diabetes, sometimes long-standing diabetes slows your intestine, thyroid, maybe stresses, and medications, they can cause constipation. And the other common type is an incoordination in the lower part of your intestine, that is the rectum and the anal canal, is, as I would say, if there's an incoordination between these two. Now, what is this incoordination? We would say that the rectum, when it compresses, the motion should come out because the anal canal should open. But in patients suffering from this incoordination, or as we can call it dyssynergia, the rectum in many cases constricts so that he gets that urge, but the anal canal does not open up. And that is when this incoordination or this dyssynergic movement in the anal canal makes the patient want to go 2, 3, 4 times.
And then that's when he will apply more pressure.
Yeah, exactly. And once you start applying a lot of pressure, you strain, blood vessels in the anal canal increase, what we call as piles, and you will bleed. There
Yes.
will be fissures.
So piles is basically a problem where you are straining so hard that the blood vessels around the anal area, they start dilating and they become big. So piles is nothing but dilated blood vessels, which will sometimes burst and drain out blood.
Yeah, exactly. It's always a sequel to constipation.
Correct, yes. So people who are constipated more often than not do end up with getting piles.
True.
Okay. So what are some simple practices that one can follow at home which can, reduce this problem or maybe prevent it altogether?
So, I mean, uh, a simple, good Indian healthy diet where you have less or no maida,
Okay.
because maida is refined flour. It's most of it is absorbed by the body, so there's nothing to form the stools.
Okay.
That so less of maida in your diet, more of other multigrains like jawar added into your atta. So you have whole wheat atta, you can probably add a bit of jawar, add a bit of nachni or ragi.
Okay.
So 2 portions of normal wheat atta, 1 portion of this, mix it up, make a roti, like a multigrain bread. So you need to add fiber to your diet. If you say numerics, you need at least 40 grams of fiber a day. That's the maximum limit.
Okay.
And that can be included with your normal salads, your whole fruits, not juices, fruits, especially like apples or maybe pears. These are the things that might stimulate your bowels.
And millets.
And millets, of course. We've also come across, there's been some studies and research about dragon fruit having a natural laxative effect, so that they can have maybe, I know it's tasteless, but it's nice.
Okay.
So they can have that, and we usually tell patients that you can have dragon fruits. Sometimes we tell them to eat prunes. Sometimes you tell patients to have maybe overnight soaked 5 to 6 black raisins. And you can soak them overnight in water, have them in the morning. So it's kind of, one, stimulate the gastrocolic reflex, and two, it will act as a laxative and help you pass motions.
Okay,
So
interesting.
these are the kind of new dadi ke nuske, if I can say, to help patients get off laxatives.
What about the famous isabgul that almost every Indian family would want to first try when they have constipation?
Absolutely.
Is it healthy? How much amount should be taken? Should you be going overboard with it? What should be done?
Right. So isabgol is a fiber. It's adds and bulks your stool. And as I always propagate this to every patient, that your colon is like a fingerprint. That means every colon would be different.
Okay.
And every colon will have a different need, dose of laxative, and a need of laxative. So any laxative will not be a one-stop shop for a particular person. Yes, isabgol adds to the stools, it adds to the bulk of stools so that it can be passed. But in patients who are not passing for maybe 2-3 days, only taking isabgol might not help. You might need to add a laxative to stimulate your intestines. More of isabgol, sometimes you can have maybe 1 scoop is about 3.5 grams. So not more than 2 to 3 scoops of isabgol in a day, because it will add to the bloating. Isabgol can cause bloating also.
Oh, is it? I don't know that. Okay.
So isabgol can cause bloating. Coming to us, if he's coming to us with a slow transit, we will probably avoid laxative, add a stimulant laxative so that his intestines are stimulated. If his stools are very hard, we'll give him like an oil-based laxative. So it kind of caters to different set of populations.
So the treatment for constipation is extremely specific and it depends on the details of how the patient is passing stools, what is the consistency of the stool. So those details need to be read properly, which I think only a gastro person can do best. So another important issue which almost half the youth in India is suffering from. Earlier on, it was only restricted to the older population. I'm talking about acidity. But these days, even the younger population has started getting a lot of acidity. In fact, I read an article which said that Kolkata has the maximum number of people with acidity, and Surat has the least number of cases of acidity. Is it because Kolkata has more non-vegetarian population compared to Surat? Do you think that could be one reason?
So acidity is, I would say, is like a very general term for maybe acid reflux, for just a burning sensation in the tummy, bloating, sometimes belching. It's like this common umbrella for all of these terms.
Okay.
When a person who visits a doctor says that he's having acidity, the doctor will always try to understand what is the cause, what sort of acidity that the patient is complaining of. Because if it's heartburn, he'll require medicines which are different. If there is bloating, he'll require a different sort of medicine, certain dietary changes. Um, if you say statistics from the age of 30, at least 1/3 of population will have acidity at any given point of time, and everybody will face acidity in their life. We've all have that. We've all probably popped in a pill here and there, taken some antacid. uh, if you say that the patient is having acidity, many a times we need to understand that acidity can be one dangerous, or it can be something very benign. Now, what do I mean by dangerous? Sometimes patients do come to us that is having a little bit of chest discomfort or tummy discomfort, and it is something that is recent onset. And if it is recent onset, we as doctors are more worried that it could be something related to the heart.
Oh.
So every time a patient who comes to us with a recent onset, like 2-3 days maybe, he's coming off some pain in the tummy or something in the chest,
Yeah.
and they would probably taken on some antacid from a chemist, from their relatives, and they're not finding it relief. We are always worried about the heart, because we have seen patients that they come with acidity type of symptoms and they have a heart attack.
Yeah. When can acidity get dangerous?
Sure. So when you say about red flags, unintentional weight loss.
Okay.
Anybody having a recent onset of acidity?
How much weight loss?
So I would say maybe 10% in the last 6 months. That is what the standard definition tells us. But if it's unintentional, that is more intriguing. If there's blood in your stools, it's jet black. Is it red? Then the blood anywhere is a red flag for anything, because it signifies something like an ulcer that's bleeding. Very rarely it can be cancer. So that is something, when we are facing with that the patient is having these sort of red flags, then we want to investigate them at the earliest. Then patient having difficulty in swallowing, that the patient would come to us and tell us that if I'm eating and I feel that something's getting stuck in my chest, that could be a sign of cancer as well. So these are red flags. And of course, the other important red flag is a family history of stomach cancer or an esophageal cancer, or more likely stomach cancer or a colon cancer. That is a one.
I'll just interrupt. Esophagus is basically the food pipe, and colon is basically consists of your large intestine, and the small intestine is connected to the large intestine, which ends into the rectum and then the anus, from where the poop comes out.
Right. So if there's a family history of GI cancers, gastrointestinal cancers, then that kind of sets the tone a little higher. We shift our gears to probably upfront asking the patient to get investigated, maybe via blood test, maybe an endoscopy upfront, because that tells us that this patient is not just having acidity. There could be certain other things that require treatment.
Okay, I just want to pop in a question here, that if somebody in his immediate family, for example, if now my grandfather had esophageal, which is the food pipe cancer, so at what age should I get screened, or I put my antenna up? Okay, now is the time that I need to screen whether if I have the tendency to get this now.
Right. So if I take you as an individual, and if you're not having any symptoms, but if you as a person is probably having a lot of acid reflux, if there's any symptoms of difficulty in swallowing, yes, we would upfront ask you. But if you're absolutely clean, if there is no symptom, it's we don't have enough data to support screening for cancers in India. In Japan, they would screen everybody for gastric cancer because the incidence is so high there.
Oh.
It's pretty high in Japan, so they would have these screening programs for gastric cancer. But for esophageal cancer or stomach cancers in India, we don't have a screening program because it's not that common.
Oh, okay.
But yes, nevertheless, if a person has a family history of these cancers, and when I say family history, I mean immediate family, like somebody like a real brother, mom, dad, somebody in your family if is having these things, and if you're symptomatic,
Okay.
then probably you should upfront consider an endoscopy.
Okay.
This
What about
is
the other parts of the gastrointestinal system? For example, if the grandfather had a rectal cancer or anal cancer,
yeah.
what about pancreatic cancer, liver cancer? Do these also not require screening if I don't have any symptoms?
Right. So if I say colon cancer or rectal cancer, then if somebody in your family, when I say immediate family, your mom, dad, or brother, if they had cancer, then this, you should be screening yourself with a colonoscopy, because colon cancer starts off usually as a polyp. A polyp is a precancerous state of cancer.
So
And
a polyp looks like, maybe like a cauliflower, I can say, which is present in the lining, the innermost lining of our large intestine.
so and that's a precancerous stage, and that can be removed endoscopically.
Okay.
So usually in our studies, we have seen that from polyp to cancer, it takes few years. So when you remove those polyps and when you send them for testing and you identify what sort of polyp it is, the next endoscopy should be done depending upon what the polyp test shows.
But at what age should I be going in for a colonoscopy?
So if your immediate family member had a colon cancer, either 10 years before or at the age of 40, whichever is nearer to you.
Okay.
So you should undergo colonoscopy. Like we had this, we had a 74-year-old lady, and she had come with a cancer. She had rectal cancer. We diagnosed her. She got treated. She was okay. So we asked her son to undergo a screening colonoscopy. He was busy, so he came back after maybe 6-7 months. And we went inside where the lady had a cancer. He had a polyp.
Oh.
And we removed it. So now, once we removed it, his polyp was precancerous, and now his next endoscopy will be probably after 7 to 10 years.
So if the grandmother or the mother, immediate relative, is at the age of 60 when they get diagnosed of cancer, rectal cancer, then the child should get himself tested, screened 10 years before that when he turns, so
Or the age of
at
40.
the age of
Or the
50
age of 40.
or at the age of 40,
40, whichever
whatever
is
is closer. Okay. It's a very common Indian problem. We all have this one auntie or uncle in the family who's always burping
Right.
persistently.
Right.
And they don't know what to do about it. We don't know what to do about it. So, what is wrong with that? And how can you kind of navigate this problem?
Right. So it's a pretty common symptom that we come in our OPD is that the patient, they usually come with a train of burps. They would just continuously burp, burp, burp. And usually these patients have what we call as a supragastric belch or something. If I can give you a spare a minute and talk about belches, it's either stomach belches or gastric belch, that is the gas that he's erupting is coming from the stomach.
Okay.
Or supragastric, that is coming from the food pipe. Okay. So gastric belch is normal. We all have belches. We all probably burping. Exactly. We would all burp. Maybe the normal limit is about 20-24 per day. So that's okay.
Okay.
Yeah, that's okay. We're okay. And it's good.
Okay.
Patients
as
do
long
feel
as it's
nice.
coming from the stomach.
Yeah. But when they would, have this continuous strain of burps, and the record that a study has published was 531 burps.
Okay.
516 burps that was done by a patient in a day, and that was traumatic for him. I can understand that the patient was suffering for such a long time. And this is a supragastric burp or a belch. This is a kind of a learned behavior that the patient is having. It is probably, if I can say in simple terms, related to air swallowing by the patient. They would, this is how they would come. So it's this swallow of air that they swallow goes inside the food pipe, and then the food pipe then eructs it out. And it's within a few seconds this happens, so the patient does not realize that he is subconsciously swallowing air and he's belching it immediately. And this happens like a train. It does not happen in their sleep, does not happen when they are either singing or talking very easily. And if you just shift their mind from their current situation, they might probably forget to burp. So that's how you realize that it's just a subconscious reflex, if I can say, that is happening to these patients.
But if it is too much, then they should see a gastro person.
Exactly.
Because what could it be?
So it is most likely related to acid reflux.
Okay.
So acid reflux can cause belching.
Okay.
And of course, this learned behavior needs to be stopped.
Correct.
And then, apart from just some medicines, patients are taught certain speech therapy exercises, certain breathing exercises that can actually abort that attack and then overall treat their condition.
Can you just show me one breathing exercise that can be done?
So it's called as diaphragmatic breathing.
Okay.
So what you do is you keep your hand on your tummy and then you tell the patient to breathe in. Many patients take their tummy inside when they breathe. And it's a subconscious thing.
Yes.
You got to tell them to breathe in, take your tummy out.
Okay.
And breathe out, tummy in.
Okay.
And do this for 5 minutes before each meal.
Oh.
And if you do it more often, the faster they'll benefit.
Okay. And it'll reduce their
the
burping
burps.
problem.
Yeah, it really helps. And it has been shown in a lot of research that has come in the last 5-10 years that the burps do get better.
And that's really interesting.
Yeah.
Okay. So everything boils down to acid reflux if you go to see. Now, is there any ghar ke nuske if supposing there is no acidity pill available when you're at work or you're outside traveling, then what can they do as an immediate measure to counteract that acidity? Like, because a lot of people go and have a cold glass of milk.
So yes, cold glass of milk in the earlier times was kind of advocated so that, it kind of just neutralizes the acid for a particular moment of time and then you get better. Some people do have a lot of water. I can say until you find probably a doctor, anybody who can just give you a medicine, till that time, if you're having an episode of acidity, people, you can have a lot of water.
Okay.
That can, kind of dilute the acid for just few moments for some time. And that should probably help you abort or reduce the effect of acidity.
Okay. But this water should be cold water or regular temperature?
Yeah, regular water.
Final question, sir. Gut microbiome. What is it? Why it's so important? Especially for Indian parents now.
So, gut microbiome is what is the second brain,
okay,
as we call it, inside your body. And gut microbiome is like trillions of bacteria inside your intestine.
Good bacteria.
Good bacteria, of course, that regulate a lot of functions, including immunity, including the food we eat, including your bowel movements. And now a lot of research is showing that gut microbiome is responsible for a lot of diseases. Like a recent study came out, they said that Parkinson's starts in the gut. Now imagine patients coming to you with probably movement disorders and you've diagnosed as Parkinson's and probably it all started in the gut long time back. So most
as a child,
as maybe a young adult.
Yeah.
So yes, gut microbiome is now the center key for a lot of research studies, and it has shown in a lot of research papers from Europe that have come up, and they said that a good diet, I remember in children, as a child, my mother would always tell me you should have good food, nahi to pet dukhega, acha khana khao, nahi to pet dukhega. Now, studies have come up that if you eat processed food, a lot of it causes irritable bowel syndrome. It causes inflammatory bowel syndrome. So your mother was right to tell you ki pet kharab hoga if you eat a lot of processed food. And processed food means anything. There are definitions for that. For me, I would say that it is anything off the shelf. that is open, and it has these additives, these food colors, these preservatives, because a lot of research has shown that food additives, um, food coloring agents, emulsifying agents likha rehta hai on the ingredients, that can reduce this good gut microbiota. It can damage the intestinal lining, and overall, and it starts if the child is taking it for a longer period of time, probably in this childhood, and then over a period of time when they go into adulthood, they will start having this problem. So the body has a certain limit till which it can take all of this, and after which it can actually cause a lot of problems in any sort of disease.
Okay, but what can they do to build their gut microbiome?
So delay this introduction of these processed foods in your child diet, and I think you can really help their gut microbiome grow better.
Okay.
You have a lot of probiotics in the market that are labeled as good. I don't know, because a lot of research has said that after years of research, they have said that yes, probiotic might be beneficial, but we don't know for what, which strain, for how long, and what dose. There are few strains of bacteria that are deemed may be beneficial. The American Gastroenterological Association has put down their guidelines of use of probiotics in day-to-day life and in GI disorders, of course. And they said that they may be helpful. So that you don't have robust data to recommend them. Yes, what you can do is you can probably include a lot of natural prebiotics in diet. Probably have coconut water. Probably have good nuts. You can have like walnuts or something. Even kacha onion is a good prebiotic.
Oh.
Yeah, so it's a good prebiotic. So a little amount of kacha onion as a salad, maybe lettuce, cucumbers. Natural is the way to go about it. You don't need any supplements if you are having a good healthy body. So if you are not sick, you don't probably require supplements. If you're having a good Indian diet, what our parents were eating when they were children, probably if you can inculcate the same today and in your future generation, that should really help them as having a good gut.
That's really interesting. I didn't know that apart from curd, there are so many other things
Oh,
that
yes.
there are prebiotic, Your father was an actor. He played the role of Yudhishthir in the legendary Mahabharat series.
Right.
But you became a doctor. Why didn't you become an actor, sir?
I get asked this a lot. My father is his. If you look at the background, he's done his radio technician degree from All India Institute of Medical Sciences in Delhi. He's done his diploma in hospital administration, and then he was working there for at least 8 years. So we have a sort of a medical background, and I was always inclined from a young age to become a doctor. And yes, there was a lot of discussions at home. They used to always, my mom is a choreographer. So it was always a family discussion to have at home that, yeah, they would always do this. But I was always inclined to, get into the medical field from school days only.
So not even once did you give an audition or something? Nothing like that.
Nothing.
There's no inclination.
No, absolutely no. I was happy in my own sweet world of medicine.
All right. Thank you so much for being on this podcast, sir. I think we've got some amazing insights into the world of gastroenterology. And it's going to be extremely helpful for the viewers today to watch this podcast, not just once, watch it twice. So, yeah, thank you.
Pleasure.